Good afternoon and welcome to the third installation in our conversation series on health equity, determinants of health, and COVID-19. Today's conversation will focus on Indigenous responses and perspectives. I am Sumindumbe Ayo, your host for today. I work with the National Collaborating Center for Determinants of Health as a Senior Knowledge Translation Specialist. It's a pleasure to be calling in today from Montreal, which is the unceded lands and waters of the Kanien'kehá:ka Nation. The National Collaborating Center for Determinants of Health, the NCCDH, is in Mi'kmahi, the ancestral and unceded territory of the Mi'kmaq. During today's conversation, we'll be hearing from our guests who will be talking about Indigenous perspectives and responses. And I'd like to encourage all of us on the line today to think about our unique relationships to the lands we find ourselves in. The NCCDH is part of the National Collaborating Centers for Public Health. Each NCC focuses on a particular public health issue, and collectively we work to strengthen public health across Canada. We are funded by the Public Health Agency of Canada, and you can find out more about the NCCs by visiting www.nccph.ca. I'm joined today on the line by my team, and you'll see them in the chat box throughout today's conversation, sharing some resources with you, responding to your questions, and interacting with you as we go. Claire Betker, Parama Zumdar, Diane Oikel, and Danielle McDonald. It's my pleasure today to welcome Clay Shirt and Dr. Angela Mashford-Pringle, both with the Waakebiness-Bryce Institute for Indigenous Health at the Dalhousie School of Public Health at the University of Toronto. Clayton Shirt is a father, husband, and knowledge keeper. He's from the Wolf Clan of Saddle Lake, Alberta, Treaty 6. Since 2017, he is supporting spiritual, emotional, personal, and knowledge journeys of students and health researchers at the Institute. Welcome, Clay. Dr. Angela Mashford-Pringle is an assistant professor at the University of Toronto, where her research focuses on Indigenous health policy and social determinants of health. Her research looks at Indigenous self-governance and self-determination, Indigenous health and education, early childhood development. She's also interested in Indigenous data sovereignty, food systems, and land-based learning and pedagogies. Welcome back, Angela. Thanks for joining us today. So when you registered for today's webinar, we asked you a number of questions. We asked you, how are you seeing Indigenous peoples across Turtle Island being impacted by COVID-19? Many of you share that existing inequities are being deepened. And we've seen this as a theme throughout our conversation series. Folks shared about the ongoing impact of colonialism in the lives of Indigenous peoples. A number of social determinants were named, particularly around housing, food, income, and access to clean water was another bit. Many of you talked about the fact that cultural safety was being compromised. Location was another thing raised, particularly for rural and remote communities, being able to have access to services and food, as well as jurisdictional conflicts being an ongoing issue. So I think as we go into our conversation with Clay and Angela, these are themes which they will pick up on in their conversation as they share with us. So without further ado, I'd like to welcome Clay. And Clay's going to respond to two questions. How can Indigenous knowledges offer as guidance in the COVID-19 pandemic? And through all of this, how are Indigenous peoples staying connected to ceremony and people while staying physically isolated? Welcome, Claire. Thank you for joining us.